Hello and welcome to Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. Welcome to another episode of Wellness Wednesday. This month we have hopped around a little bit. We've touched on several different topics. August had some really juicy topics to discuss, and so I wanted to make sure that I highlighted some of the ones that I felt would be really important for my viewers and my patients. This week we're going to hop around just a little bit more, but it's not a topic that is on the August health list of things that are highlighted or talked about in the month of August, but it is something that I have experienced and that I'm seeing in the community and with some patients and people that I've come across, and that is hypertension and individuals not really taking their diagnoses of hypertension seriously. So I want to highlight a little bit on that and talk about high blood pressure, what it is, and why it's considered to be, or why it's called a silent killer. Many individuals who have hypertension or high blood pressure don't know that their blood pressures are elevated unless they are checking their blood pressures on a routine basis. Many times we go based off of how we feel, and that doesn't really mean a lot. There are individuals who are walking around with blood pressures in dangerous zones or dangerous rates, and their bodies have just kind of adapted to it over time. I just had a conversation with a colleague of mine, and she saw a patient who had a blood pressure of 210 over 170. And this person is sitting up talking to her and did not see the importance of why they needed to go into the emergency room and be seen immediately. So let's talk a little bit about blood pressure. What is it? We call it blood pressure in the lay terms. In medical terms, we consider it to be hypertension, and it's where the blood pressure is elevated. And the reason, as I mentioned, hypertension or high blood pressure can go unnoticed unless you're getting routine screenings and checking your blood pressure on a routine basis. It can be a silent killer because it's doing the damage already to your body. And then by the time we realize that it's a problem, many times it's already caused organ damage and has caused other symptoms. And so it's so important. As I mentioned, you guys know I drive home, getting your physical exam every year, going to your primary care provider, going in when you feel like something is not right, and just doing the things that you need to do to be an advocate for yourself. Left untreated, high blood pressure increases the risk of having a heart attack, creating blockages in the arteries, coronary artery disease, kidney failure, heart failure, issues with blood clots in the legs or plaque buildup in the legs, and dementia. And I apologize, there is construction going on in the building that I'm in. I was hoping that they were done for the day, but they're not. So, anyhow, you may hear some background noise, and I do apologize in advance for that. High blood pressure also can lead to sexual dysfunction and vision problems, including blindness. And so I can recall many years ago, I did a project in school where I was helping a group of um, students. I was the assistant that was part of my bachelor's program. My capstone project was to assist some other students, and we were out in the community in the Paramore area, and the students had to do everything within the area. They had to go eat at the local restaurants. They had to go, bring their laundry there. They had to catch the bus from UCF into the community just to immerse themselves within that community. And we met at one of the local community centers. And during that time, we the students came up with a project to go into the community and educate the community members on high blood pressure. And one of the students came up with an idea that one week we would go into the barbershops and hair salons on a Saturday or a Friday and provide education and blood pressure screenings. And we did that. And the number of individuals who did not know that they had elevated blood pressures was astounding. And the number of individuals who, when we followed these people for a month, I believe it was, that we had to follow every week. We would go back, the students would go back out and they would check their blood pressure. They would, check their diet log, what they've been eating, provide them with education. We were able to even connect them with the health department right in the area to be able to provide them with the health care that they needed. That's when you could go to the local health department. Now it's a lot streamlined, and then you have more health departments in the area, or the community health centers within the different communities. And so brain aneurysms, stroke are all things that can occur when an individual's blood pressure is not regulated, when it's not well controlled, and when it's left untreated. When we were talking to these men in the barbershops, one of the things that really got them to pay attention was that high blood pressure can cause sexual dysfunction, because the private area, the penis, is full of blood vessels, and the whole process of, you know, getting an erection can be hindered if the blood pressure is not well treated. And so we were able to talk to these men about that. Not just that, that's important, right? We're not going to brush over that, but making sure that they don't have a heart attack or a stroke, or that they don't develop an aneurysm or heart failure or kidney failure, is just as important. But that was another way that we were able to enter into that conversation and kind of get their attention, was when we mentioned that part of it. And so, what is blood pressure? When we talk about blood pressure, I assisted with a event this weekend, and was there taking blood pressures and answering health questions and things of that nature. And the number of individuals that came and sat in my chair and I checked their blood pressure, 9 out of 10 had elevated blood pressures. And I mean, some young individuals, young, like 12 and 13, with elevated blood pressures. And so I was beginning to educate them on what blood pressure is. And so what blood pressure is the heart pumps the blood through the arteries, and the body's major blood vessels, and the blood, pushes it against those walls. And the pressure that's created is by the pushing. The pushing is the blood pressure. So when we're checking the blood pressure, it's the force at which the blood is flowing through the arteries and those major blood vessels. And how do you know if you have high blood pressure? One of the things is, one, you want to make sure that you're checking your blood pressure, but also knowing the numbers. And we talked about this before, I think last year sometime, we talked about knowing your number, where we talked about cholesterol, glucose levels, all of those things. And so when we talk about the blood pressure, it consists of 2 numbers. You have the top number, which is called the systolic blood pressure. And that's the number where the pressure against the arteries, the pressure that's within the arteries when the heart beats. Okay, so that's the systolic blood pressure. The diastolic blood pressure is the bottom number, and it's the pressure against the arteries when the heart relaxes. So you have systole when the heart pumps, and you have diastole when the heart relaxes. And that gives you the top and the bottom number. And so over time, guidelines have changed in regards to what those numbers should be. I remember when I was in nursing school, when I first started out, the golden rule was 120/80. Those numbers have been relaxed somewhat over the years. The American Heart Association and Cardiac Association, all these different individuals who do research, have come up with new guidelines on what those numbers should be. And so the top number, the systolic number, what the most recent guidelines are saying is that it should be no more than 130. So if the number is greater than 130 on that top number, this individual can be considered to have high blood pressure or hypertension. And the bottom number should be no more than 80. So if you have someone that has a blood pressure above 130/80, then we can say that they have hypertension. However, there's a caveat to that. When we suspect someone to have hypertension and they're coming in and they've been in traffic, they had to rush to get into the office, and then we bring them right back. They've had to sit in the waiting room, but then we rush them back and we check their blood pressure. Chances are it's going to be elevated, right? So typically we want that individual to rest and just kind of, be at a restful state for about 10 to 15 minutes before we check the blood pressure, just to make sure that they're calm, that It's not stress induced that their blood pressure is elevated. They're not anxious or anything. They don't have white coat syndrome, which, if you don't know what that means, many individuals get nervous when they go into a medical office. And you see, I have my white coat behind me. 9 times out of 10, we'll wear those coats, and individuals will be a little anxious. So it's considered white coat syndrome. However, if your blood pressure is always elevated, whether you're in the office or at home, it is not white coat syndrome. So I just want to say that. But in order for us to diagnose a person with hypertension, we have to have 3 abnormal readings at 3 different times. So unless a person comes into me and I'm looking at medication that they're taking, I'm getting a history on this individual, and they're telling me that they have a history of hypertension, I'm able to look at their notes from previous providers, and I see that they have hypertension. They have hypertension. However, if I have someone and their blood pressure is just a little elevated and I'm continuing to monitor, and they're going up, or they're symptomatic, then we can talk about whether or not, based on my clinical finding, if there's going to be a diagnosis of high blood pressure. As we age, blood pressure numbers tend to increase. However, that's individual, right? It's based on the individual, because we have people who are exercising, they're doing well, they're eating well, they're monitoring their sodium, they're drinking, all the fluids that they need to drink. Their blood pressures can stay at their baseline. However, there are chances that as we age, our arteries sometimes become a little stiff, which is hardening of the arteries, and it takes more force for the heart to pump the blood through the vessels, which then can increase the blood pressure numbers, and it increases the risk for stroke and death and heart disease. So the American Heart Association has 5 blood pressure ranges when we talk about normal versus elevated, right? So we look at normal blood pressure. And again, the American Heart Association is saying a blood pressure less than 120/80 is considered normal. And again, depending on where you're looking and what references you're looking at, you might see 130/80 or 130/90. I like to stick with the 120/80 because I feel like if you're there or below that, then you're pretty good. People in this range generally have heart healthy diets and habits. They exercise pretty well, or it's just their norm. And, genetics is amazing in what it can do. Looks can be deceiving. You can't look at a person and think, oh, they may be a little obese, or they're eating all this salty food, or I'm watching them eat all this bad food. Their blood pressure has to be elevated. That's not necessarily the case. Elevated blood pressure is anything, according to American Heart Association, as of 2024, anything above 120 to 129, and anything less than 180. So if that top number is between 120 and 129, and the bottom number remains at 80, it is considered elevated. Okay. People in this range often develop high blood pressure unless diet and habits are changed. Lifestyle modification. So if we see that the blood pressure is steadily increasing, and we're providing them with information on lifestyle modification, lowering the sodium, drinking the excess, drinking the fluid, exercising, getting the good fats, the good cholesterol, the good fats, and eliminating sodium in the diet, we begin to see those numbers reverse. So hypertension stage 1 is when you have a blood pressure that's between 130 and 139 with the systolic, which is that top number. The bottom number can be anywhere between 80 and 89. People in this range are typically given medication or lifestyle modification. We tend to want to start with lifestyle modifications. Again, we've talked about them before: exercise and diet, drinking the water, eating all the fruits and vegetables, eating the rainbow of in your plate to make sure you're getting all the good nutrients that you need and healthy foods. If that's not working, then we will put them on a low dose medication. I want to throw in a caveat here. When we're talking about medication, there's a medication called lisinopril. Lisinopril, many Black and brown individuals do not do well with this medication. Not saying that you can't take it. Those individuals, we are just at a higher risk for developing something called angioedema, right? So I want you to have a conversation with your healthcare provider. And again, it's not a cookie cutter. It's not one all be all that every Black and brown person will develop angioedema. We've just seen increased incidence in that population, in that ethnic group. Okay, so just keep that in mind. Know the medications that you're taking. And I'm gonna put this in. Every medication will probably list 1,000,001 side effects. They have to list any potential side effects. A person could have been in a drug study and it had nothing to do with that medication, but they developed a cold sore. Let's say that they developed a cold sore while they were in this clinical trial testing this medication. They have to put that down. So just because there's a sign and symptom there does not necessarily mean that you will develop them. It's so that you are knowledgeable and you know what to look for, and you know how to be able to balance the risk versus the benefits of the medication, and having those conversations with your healthcare provider. Stay off of Google. Not really, but really. Okay. Have that conversation with a licensed, experienced healthcare provider. I feel that many individuals go on Google, they start Googling signs and symptoms, they start Googling side effects, and it scares them away when this medication can be used successfully when they're being monitored and they're being followed by an experienced healthcare provider. Stage 2 hypertension. Let me get off my soapbox. Stage 2 hypertension is 140 over 90 or higher. And these individuals are absolutely on medication, and most likely they are prescribed lifestyle modifications as well. When we think about the blood pressure and how the numbers range, I always have my patients or individuals that I talk to check their blood pressure a couple times throughout the day. Maybe in the morning when you first wake up, or in the evening, or once you get off work, or what have you. So that way you can kind of monitor what those numbers are. If the numbers are normal in the morning, 120 over 80s, right? And then by the evening it's elevated, the first thing I want to know is, what did you eat that day? What stressors were you involved in, or what stressors were impacting your life that day? And then we kind of do a process of elimination to try and figure out what's causing it. Many times, if we scale back on the extra sodium that we're putting on our food, or that we're eating in processed foods, we begin to see these numbers go down in individuals who deal with obesity or being overweight. Once we start getting them on a good regimen, weight loss medications, what have you, exercise, diet, intermittent fasting, whatever works for that individual, once the weight goes down, we begin to see that their blood pressure does decrease as well. So hypertensive crisis is when we have blood pressures that are 180 over 120 and higher. These individuals require immediate medical attention. And I talked with a colleague today, and this patient had a blood pressure of 110 over 170 or 180 or something like that, and did not want to go to the hospital. It's so important that we listen to medical advice, and not to say that you have to do everything that's being told to you, but at least take that information, and if you need, get a second opinion. But if your life is in danger, we want you to act quickly. For individuals who are in a hypertensive crisis, we want to make sure that we're getting them to the hospital as quick as possible. We're getting medical care to them quickly. And if that means we need to call 911 or EMS to get to them, then we need to do that. We don't want to risk precious time and this individual having some issues. So how do you lower your blood pressure when it's high? We talked about that. Medication, of course, but we want medication to be the last resort for it, right? So lifestyle modifications, changing how you're eating, changing what you're eating, the amounts of certain things that you're eating, trying to eliminate the processed foods, eliminating the salt in your diet, losing weight, exercising. And we've talked about that before. 30 minutes of moderate exercise 5 days a week. And studies have shown that even 10 fewer pounds can lower the blood pressure 5 to 10 millimeters. 5 to 10. So if you're at 130 and you begin to exercise and you're consistent, we can potentially see that blood pressure come down to 125, 120. increase in exercise, stop smoking, limiting alcohol intake, and then if you are going to drink, limit it to 1 to 2 per day if you are a drinker. People who have elevated heart or blood pressures are at risk for cardiac issues. So cardiac risk factors, diabetes, family history of heart disease, will most likely be placed on medication because of those comorbid conditions or those things that are adding to the problem that they already have. We want you to make sure that you're talking to your healthcare provider and that you're knowledgeable, which is the whole my sole purpose of providing this. I'll say it. The mission of Wells Legacy Health and Wellness is to ensure that our patients, our family, and our community have the information that they need to be able to advocate for themselves and to create a legacy of good health. Good health starts with you. And if you know it's an issue within the family, why not be the one person to make it stop, to change the history by creating the legacy of good health, good eating habits, exercising, taking care of yourself, going in to get your screenings when you need to. It is so important that we do that. When it comes to checking the blood pressure, of course, you're going to have that done when you're at your healthcare provider for your annual physical exam, right? And if you are an individual that has hypertension, then you're going to probably be seeing that your provider maybe 2 times a year, just to kind of monitor for blood work, because we want to make sure that your numbers are where they should be and it's not causing any type of organ damage, your kidneys, your heart, things of that nature. If your blood pressure is high or low, your healthcare provider can help you figure out why. We'll do some diagnostic testing. Blood work is going to be the first thing. If it's continuing to be high, then we'll look at the kidneys. There are different kidney disorders or issues with the kidneys that can cause elevated blood pressure. The kidney, as we mentioned in one of the lives, it's almost like a filter. It gets rid of waste product. And so if you're drinking fluids, your body begins to eliminate waste. And one of the things is sodium. So it's helping get rid of the sodium in your body. And if there's something going on with the kidneys, in your blood work, we can see some elevations in some of the levels that are specific for the kidneys. And then also we might see an elevation in the sodium level as well. That's very, very telling that if this individual is someone who is taking in a lot of sodium and they're having issues with their kidneys, their body's just not getting rid of that excess sodium. We want to make sure that you're being proactive about your health and that you are doing what you need to do to take care of you. I know this month we also talked about breastfeeding moms, and I do want to highlight high blood pressure in the pregnancy and postpartum is what I wanted to say. This weekend I had the pleasure of sitting and talking with a young lady who had a baby, and she was being treated for elevated blood pressure during her pregnancy and still required treatment after. And we just had a conversation about that, how important it is for her to continue with that, to continue following up with the provider, getting her blood work done, things of that nature. And many times with women and in the pregnancy, they can develop preeclampsia or eclampsia. And that's where the blood pressure is elevated due to different factors within that pregnant woman. And many times delivering the baby will cause that problem to go away. However, sometimes it does not, and it continues into the 4th trimester, which is the postpartum period. So it's important that if you have been told that you need to take medication or you need to monitor your blood pressure, please do so. Please do so. You can get a electronic wrist blood pressure cuff from Walmart, from CVS, from Target, what have you, for less than $20. We spent $20 at Chick-fil-A. I don't eat the chicken anymore. I can't. That was my favorite. But anyway, we spent $20 in a matter of minutes. Why not take the time to purchase something that's going to help you overall when it comes to your health? When it comes to different individuals and their genetic makeup, some individuals are just at a higher risk for developing high blood pressure. And you have to know your family history. Knowing your family history is so important, because if you know that you have a family history of high blood pressure, then you're able to provide your healthcare provider with that information, and then they're able to develop a plan of care for you that can help you, one, eliminate the increased chance for you developing hypertension yourself, or if you have high blood pressure, working with you to put measures in place to help you decrease that blood pressure to a level that's going to be conducive and not cause additional harm to your body. If you've been prescribed medication for your blood pressure, take it. If you've been prescribed more than one medication for your blood pressure, take it. If you've been prescribed 3 medications for your blood pressure, there's a reason that you were giving that medication and in that amount. But you also have to do the work yourself. Working out, exercise, eating healthy, drinking, the fluid, half of your body weight in water. But we want to make sure that you're taking care of yourself. And ultimately, it's your responsibility. The healthcare provider can provide you with the knowledge, they can provide you with the facts, but then it's up to you to decide what you're going to do with it after that. This was a subject that it really bothered me this weekend, and having conversation with individuals. Well, I just don't check my blood pressure. I feel fine. You feel fine, but internally there's some damage being done to your body. And then you feel fine until you don't. And so we want to make sure that everyone is living healthy lives, that you're going to get your healthcare screenings, you're checking your blood pressure if you need be. And if you don't have a machine or you can't afford the machine, Publix and some of the different Walmart have the blood pressure cuffs there in the store, even Target, I think. If not, you can go to the fire department and they'll check your blood pressure for you. But if you have been advised to follow up regarding hypertension, please do so. Don't put yourself at risk for developing a stroke or a MI, a heart attack, congestive heart failure. Don't do it. Take time to invest in your health, and that can mean different things to different people. But for me, that means knowing what's going on within your body, taking the steps to reverse anything that's abnormal, and taking the steps to learn what you can do to improve your health overall. I'm going to end tonight, but I just want to say thank you so much. If you are in need of a healthcare provider, we are now accepting Blue Cross Blue Shield. We are also accepting TRICARE East and Medicare. We are waiting for Cigna, Aetna, and a few others. So check us out. If you need a physician, if you need a healthcare provider, we're here for you. I'm not a physician. I don't know why that came out, but I did have a conversation with someone that was looking for a physician, and she did not want a nurse practitioner, and I was able to help her find a medical doctor. I am not a medical doctor. I don't even know why that came out. I think it's because I was thinking of this situation with this individual. But if you want a healthcare provider, I might not be the provider for you. I don't have a problem helping you find a really good provider in your area. So, but we are accepting new patients. My patients that come see me love me, and I love them. We are located at 452 Osceola Street, Suite 106 and 107 in Altamont Springs, Florida. Our number is 321-306-6755. I'm learning that there's another number out somewhere, and my team is attempting to track it down, but it's an old number for us. So we're trying to track it down and make sure that we get that removed from all platforms. But the number that we can be reached at is 321-306-6755. You can also go to our website, check it out, look into schedule an appointment. You can schedule online or you can give us a call. Until then, stay safe and be well. This is Dr. Latoya Wells. Stay safe. We'll talk to you later. Until next time. Bye-bye.